Harris Rosen tells us he has found a way to provide health care for his workers while saving millions of dollars and avoiding Obamacare.
Put 42 stitches in my head. Haven't taken a penny salary in 6 months. And that was the worst time of my life. $1 trillion a year.
Unbelievable.
How is it possible? Hard work, hard work, hard work.
Now, this piece is very controversial. You're a great example of how a rich person or a person with the resources can do small things. And the reason I say it, like recently I even did post about it, because so many people don't do what they can. Because for me, living in America, you can do so much. You can help so many people. You make $80,000 a year, you can help so many people.
Of course.
But we don't do it. And then we're like, oh, Bezos has 200 billion. He could end poverty in the entire state. Well, I don't think that throwing money, Bezos' money, would help anyone. And he fixes his problems. You fix problems in a completely different way. So I absolutely salute you. Thank you for what you do. Next question is, you also fixed huge problem with the healthcare.
Yes.
That was also revolutionary. And you stood up to Obamacare and you said, hey, we could do better. Let's talk about it.
Harris Rosen tells us he has found a way to provide health care for his workers while saving millions of dollars and avoiding Obamacare. Griff Jenkins hit the ground in Orlando.
Greta, here in Orlando, Florida, visitors can't help but notice the sprawling hotels and resorts owned by Harris Rosen, like this one behind me, Shingle Creek. Mr. Rosen not only created a hotel empire, he also launched a self-funded insurance program for his more than 4,000 employees that he says has saved the company more than $200 million since the early 90s. Under Rosen Care, the average monthly premium for employees is $60 with a maximum deductible of $1,000. The company pays the rest. By comparison, under Obamacare in Florida, the lowest a person would pay for a premium is $96 with a deductible of 40% of your health care costs.
Oh.
What was behind it?
We call it Rosen Care.
Rosen Care. Rosen Care versus Obamacare.
Yes, and we've been doing it for about 25 years. Wow. What happened was that we had normal insurance, and we had a good year. Our costs were down. But when I got the new bill, my costs went up about 30%.
And you have 4,000 employees.
Yes, that's right.
That's a big bill.
Yes. So I called, and they wouldn't talk to me. I called another number and finally got a hold of someone in the insurance company. And I said, why am I paying so much more when my costs were down? He said, well, it's the group you were with. I said, what group? He said, well, we put everybody in a group. No, I don't want to be in a group. I want to be by myself. Well, you don't.
Who are there in the group? Like, just
I don't know, just people. They just put us all together. They bundled us all together. I said, I don't want it. He said, you don't have a choice. I said, what do you mean I don't have a choice? This is the way it works. I said, no more. He said, what do you mean no more? I'm finished. Goodbye. Now I said, now what do I do? Now what do I do? So a thought occurred to me. Create your own insurance company so you can be self-insured.
That's what you did?
And number two, find a little building and create your own little medical center. And then do your own deal with the hospitals.
This is unbelievable.
So I had an accounting office, and because we were getting so big, that little building was too small. So we thought we were going to have a little kindergarten for all of our employees' children. But I said, we're only taking care of maybe 40 or 50 families. I want to take care of everybody. So I said, I have an idea. We're going to hire a doctor, a nurse practitioner, and some administrator, and we're going to convert that into a little clinic. Rosen, you're crazy. What do you know about healthcare? I'll learn.
This Entrepreneurs 101.
We created our own insurance company called Provinsure, which now has probably 200 other clients. Yes, very successful. And we have, I don't know if you've seen our medical facility.
Yeah.
It's beautiful. the Rosen Care medical facility. We
Doctors, nurses.
Yes, absolutely. We have 4 full-time doctors.
Is it regulated? Did anybody came back after you, like say you can't do this?
No, but it is. Yes, of course, there's certain regulations, but we adhere to all of them. And
who runs it in there?
we do. We run it.
Like, do you have?
We have our own. We have our own management team there. We have our own head physician, and we operate it much more efficiently than hospitals are
Absolutely
operated.
love it. So, and you fund it with the money you would other way to pay to Obamacare or.
Oh, absolutely. So, listen, if the United States of America adopted the Rosen Care formula based on what our costs are per employee, you're not going to believe this. The United States of America would save about $1 trillion a year.
Unbelievable. This is just.
And so we have spoken to senators, congressmen, vice presidents, governors. They don't really care.
Why? Why do
they don't? You know why?
Hey, Trump, are you listening? Can you please take notes?
They don't care because it really isn't something that they're interested in.
I mean, saving $1 trillion for economy?
And let me share this with you, Dimitri. In order to keep the costs down, because my associates, who are hourly associates, pay $850 a year for health care. If they go to a hospital, the most they pay is $750. I don't care if they spend $100,000 or $200,000, $750. 2 visits at $750. After that, they pay nothing.
Wow.
If they need pharmaceuticals, they go to Walmart, they show their Rosen card, Walmart gives it to them, I pay for it.
And it's still cheaper for you.
Oh, of course, because Walmart loves to have all of my thousands and thousands of employees stop in there to pick up their prescription and shop. So Walmart was very happy to give us a discount.
Wow.
So you don't pay for any of. Why is that important? Because what happens in today's world, people need to take certain pharmaceuticals. They're expensive, and so they don't do it, and that is not good for their health. Our people go. They take whatever the doctor prescribes. So that's Rosen Care. That's Rosen Care. And we also negotiate with hospitals, probably a little bit better than other companies do, because we have some leverage.
Love it.
Averages.
Compare, if you will, for me, Rosencare to what is now known as Obamacare.
Well, it's so incredibly different because they're part of the family here. They know the docs here. They know the nurse practitioners here. They know everyone behind the desk. They feel comfortable coming here. And it's part of their family. Obamacare, you never know who you're going to get. So when they say you can keep your doctors, well, that's not true. If the employer has to pay the fine, where are you going? You don't know where you're going. Who are you going to see? You don't know who you're going to see. How far away is it going to be? You don't know where. This is here permanently. And they can come anytime they want. And when they come, they remain on the clock. If they don't have a car, we drive them.
It's all on you. This is costing you.
No, it's not costing me anything because these are my family members. I love them dearly, and I want them to be healthy.
Thank you so much for your time.
Thank you
sharing
so much.
all the wisdom.
Happy to do it.
Rosen Plaza is the place for Roofing Process Conference. I hope to see you guys all in December. We have about 500 attendees. We're trying to cap it at that. You have to pre-register. We have about 30 vendors. Hit me up if you guys have any questions, and all the links are going to be in the description below.